Hi, my name is Taylor Key. I'm 23 years old and I'm applying for the BSN to DNP program with my focus being on family care. I graduated from Jacksonville State 2 years ago this May with my Bachelor's of Science in Nursing. During my time at JSU, I was very active on campus and in the nursing program. I held many officer positions along campus, my most favorite being the communications officer for the Jacksonville Association of Nursing Students. It was here I got to raise money for Relay for Life and raise money for things we needed around the nursing building. And it was great to help give back to a group of individuals and teachers and peers that helped me to become the nurse I am today. After nursing school, I started my career off in a surgical and neurosciences ICU at St. Vincent's of Birmingham. It was here I sharpened my skills and knowledge learned at JSU to become a prudent ICU nurse. I acted as charge nurse on occasion and became entrusted to respond to rapid response calls, which help prevent a patient from progressing into respiratory or cardiac arrest when their health declines. After 10 months at St. Vincent's, I accepted a position at UAB Hospital, the Trauma and Burn ICU, and I transitioned to PRN at my previous role at St. Vincent's. At UAB, I've been challenged in a way that only an academic medical center can provide. I am expected to provide care to some of the sickest people in the Southeast in a more autonomous manner, and I have learned something new every day. I began reading textbooks for fun just to provide better care for my patients. This relentless studying has paved the way for me to earn my CCRN certification, which I earned last month. And my new and challenging environment has inspired me to learn more and pursue a terminal degree in nursing. What better place to chase this goal than at the institution that taught me everything I know that is nursing? I believe it is time for me to step aside from an acute care role and step into a primary and preventative care setting. Originally, I had planned to use this degree in a global health situation. I have a passion for the well-being of humanity and would be humbled to provide care to those in developing countries by educating vulnerable populations on the prevention of transmission of diseases and providing vaccines and medications and serving as a primary care provider to those who have no access to health care. While this is still a wide open option for me, my eyes have been opened to a new possible path in orthopedics due to a recent event in my life. I'm a rock climber, and on a climbing trip 2 months ago, I fell onto a locked knee and completely ruptured my ACL and sprained my MCL and my LCL. I was the only person in our group with any medical knowledge, so it was up to me to stabilize my knee and safely get off the mountain to a higher level of care. This knowledge and training was provided to me through an advanced wilderness life support class taught through the Wilderness Medical Society. Because of that fall, the roles were reversed. I was no longer a healthcare provider, but I became the patient of a sports medical clinic at UAB. If I wanted to continue doing the things I love to do, like rock climbing, backpacking, I needed surgery. Healthcare in an entirely perspective. I was now the patient. I had to go through physical therapy, which I'm still going to weekly, and because of this traumatic injury, I have been provided the empathy I lacked, and that has helped me care for my patients immensely through an I've been there understanding. I can now look at my patients and I know what they're going through. I know how hard it is, and I know how disruptive it is to someone's life. And I feel like this gives me the passion to help them push through it and get over this hump, because it's just a small part of their life. We're gonna get them out of there. And as an avid outdoors woman, I come across many people injured in a wilderness setting. This is why I seek the advanced knowledge that would be provided to me by becoming a nurse practitioner and earning my doctorate. And I want to be able to provide, to people who have had an orthopedic injury or sports injury, or also if I come up on somebody in the woods somewhere, help stabilize them and pack them out of there and get the care that they need. But in conclusion, I believe the family nurse practitioner path is what I need to journey down in order to make my passions a reality. Thank you so much for considering me to be a part of the flagship program at JSU. Best wishes in deciding amongst all the candidates who applied alongside me. Take care.